We all need connection. It's a basic human need, but as we age, staying connected can get harder. This can lead to loneliness, a growing problem for our seniors. Loneliness is more than just being alone. It's feeling isolated and disconnected. It's that feeling of emptiness when you long for companionship, and it can have serious consequences for mental and physical health. Imagine feeling invisible, like your presence doesn't matter. That's what chronic loneliness can feel like. It's a silent epidemic affecting millions of seniors. We need to address this issue head-on. Our seniors deserve to live their golden years feeling valued, connected, and emotionally healthy. So why are so many seniors experiencing loneliness? It's a question that has many layers and complexities. There are many contributing factors. For some, it's the physical separation from family and friends. Sometimes it's a combination of things that leads to feeling isolated. The transition from a busy, active life to a quieter, more solitary one can be jarring. Retirement is a big one. Leaving the workforce often means losing daily interactions with colleagues and a sense of purpose. It can disrupt routines and social circles. The structure that work provided is suddenly gone, leaving a void that can be hard to fill. Loss of mobility can also play a role. When getting around becomes difficult, it limits the ability to participate in social activities. Difficulty getting around makes it hard to engage in activities and maintain relationships. This physical barrier can lead to a sense of isolation. Then there's the loss of loved ones. As we age, it's inevitable that we lose friends and family members. Friends and spouses pass away, leaving behind a profound sense of loss and loneliness. Children move away for work or family. While technology can help bridge the gap, it's not the same as having loved ones nearby. These losses create a void in a senior's life. The absence of familiar faces and voices can be deeply felt.
It's like one day you wake up and realize your world has gotten smaller. The places you used to go, the people you used to see, they're all just memories now. And realize your world has gotten smaller. The once vibrant social life has dwindled, and the days feel longer and lonelier. The people you used to see every day are no longer around, and the activities that once brought joy seem out of reach. And it feels like a part of you is missing. The connections that once defined your life have faded, leaving an emptiness that's hard to fill.
Loneliness isn't just a feeling, it has real consequences for mental health. It's a pervasive issue that affects millions of elderly individuals around the world. The feeling of being isolated can be as harmful as any physical ailment. When we think about health, we often focus on physical aspects, but mental health is just as crucial. Loneliness can creep in slowly, often unnoticed, until it becomes a significant burden. When we're chronically lonely, our brains react like we're in danger. This isn't just a metaphor. Scientific studies have shown that loneliness triggers the same stress responses as physical threats. The brain's reaction to loneliness can lead to a cascade of negative effects on the body. This triggers a stress response that can be harmful over time. The constant state of alertness can wear down the body, leading to increased blood pressure, weakened immune function, and even inflammation. Over time, these physical responses can contribute to serious health issues. Chronic loneliness increases the risk of depression and anxiety. These mental health conditions can further isolate individuals, creating a vicious cycle that is hard to break. The emotional pain of loneliness can be just as debilitating as physical pain, affecting every aspect of a person's life. It can even contribute to cognitive decline and dementia. The lack of social interaction and mental stimulation can accelerate cognitive deterioration, making it harder for elderly individuals to maintain their independence and quality of life. Studies have shown that loneliness can be as damaging to health as smoking or obesity. The impact of loneliness is profound and far-reaching, affecting not just the mind but the body as well. It's a hidden epidemic that needs more attention and understanding. It's a serious issue that deserves our attention. By fostering social connections and creating supportive communities, we can help mitigate the effects of loneliness. Simple acts of kindness and inclusion can make a significant difference in the lives of elderly individuals.
We need to recognize the signs, look for changes in behavior, such as withdrawal from social activities, changes in mood, or a lack of interest in previously enjoyed hobbies. These can be indicators that someone is struggling with loneliness, and take steps to address loneliness in our elderly loved ones. Regular visits, phone calls, and encouraging participation in community activities can help, Professional support, such as counseling or therapy, can also be beneficial. It's crucial to understand that this isn't just about feeling sad, it's about a significant impact on overall well-being. Addressing loneliness is not just a compassionate act, it's a necessary step towards improving the health and happiness of our elderly population.
Loneliness doesn't just affect mental health, it impacts daily life in many ways. It can seep into every corner of a person's existence, making even the simplest tasks feel insurmountable. It can make it hard to find the motivation to do the things we used to enjoy. Simple tasks like cooking, cleaning, and maintaining a tidy living space can become overwhelming challenges. The once enjoyable activities now seem like monumental tasks. Personal hygiene, which is crucial for health and well-being, can also take a backseat. The effort required to take a shower, brush teeth, or even change clothes can feel like climbing a mountain.
I've seen seniors who just stop trying. They lose interest in activities they once loved, and their days become a blur of inactivity and despondency. They don't want to get out of bed, preferring to stay under the covers where they feel safe, even if it means missing out on the world outside. They don't want to eat, losing interest in meals that once brought them joy. This lack of appetite can lead to malnutrition and further health complications, and they don't want to see anyone. They might ignore phone calls and avoid answering the door, cutting themselves off from the outside world. It's like they've given up. The spark that once lit their lives has dimmed, leaving them in a state of perpetual sadness and isolation.
Seniors experiencing loneliness might withdraw from social activities, making it even harder to connect with others. They might stop going to community events, clubs, or even family gatherings. This isolation can lead to a downward spiral. The less they interact with others, the more isolated they feel, and the harder it becomes to break the cycle. They might experience changes in appetite and sleep patterns. Some may lose their appetite entirely, while others might overeat as a way to cope with their feelings. Sleep can become elusive, with nights spent tossing and turning. Their physical health can also suffer, making them more susceptible to illness. The lack of physical activity and poor nutrition can weaken their immune system, leading to frequent doctor visits and hospital stays. The cycle of loneliness and declining health can be difficult to break, but recognizing these impacts is the first step towards finding solutions. So how do we combat loneliness in our elderly population?
It starts with recognizing that it's a common problem and not something to be ashamed of. We need to create an environment where seniors feel comfortable speaking up about their feelings of isolation.
We need to listen with empathy and let them know they're not alone. Then we can work together to find solutions.
Sometimes it's about reconnecting with old friends and family. Other times it's about finding new ways to engage with the community.
Families play a crucial role in combating loneliness in seniors. Regular visits, phone calls, and video chats can make a world of difference.
It's about showing them they're loved, valued, and not forgotten. Encourage them to participate in family activities and gatherings. Even if they can't physically be present, technology allows them to join virtually and feel included.
Be mindful of their living situation. If they're living alone and struggling, consider alternative living arrangements where they can have more social interaction.
Communities also have a responsibility to create opportunities for seniors to connect. Senior centers, community gardens, and volunteer programs are great ways to foster interaction and combat isolation.
Organize outings to museums, parks, and cultural events. Provide transportation assistance for those with mobility issues.
Encourage intergenerational activities that bring seniors and younger generations together. This can help bridge the generation gap and create a sense of belonging for everyone involved.
Having a sense of purpose is crucial for overall well-being, especially as we age. Encourage seniors to explore their passions and engage in activities that give them a sense of fulfillment.
Volunteering is a fantastic way to give back to the community while staying active and engaged. It provides a sense of purpose and belonging that can significantly combat loneliness.
Other options include taking up a new hobby, joining a book club, or learning a new skill. The key is to find something they're passionate about and encourage them to pursue it.
Loneliness among seniors is a complex issue, but it's not insurmountable. By understanding the causes, recognizing the signs, and taking proactive steps, we can make a difference. Let's work together to create a society where our seniors feel valued, connected, and supported. Let's bridge the gap between generations and foster a sense of belonging for all. Remember, a little kindness and understanding can go a long way in brightening the lives of our elderly loved ones. Let's make sure they know they're not alone and that their golden years are truly golden.